Very good morning class. Today we are going to discuss about the topic which is oral habits in children. Oral habits have been introduced which is like a frequently children acquire that may either temporary or permanent be harmful to the dental occlusion, and not to the dental occlusion but also these oral habits will give the problem to the supporting structures. When this oral habit causes the defects, the oral facial structure will be deficient and there will be a habit which is called as a Purkinje's habit. When we see about this oral habit, there are different terminologies which has been divided. According to the Butterswatch, it's a habit which is a frequent constant practice, which is acquired tendency, which has been fixed by the frequent repetition. Now, let us see about classification of the oral habits. Oral habits have been classified by the different authors, which are like by the William James, which is said as a useful habit and the harmful habit. Now coming to the useful habit as we all know, this is a habit which is being seen regularly with the physiological function which is called as a nasal breathing, which is a basic physiological formula which has to be seen or taken care. Can you please off the suction. Now coming to the useful habit which is being considered as essential or the normal function, such as proper positional or the tongue, respiration and the normal deglutition. Harmful habits have a deleterious effects onto the teeth and their supporting structure. Coming to the classification by Morris and Bohana, the oral habits are being designed as a pressure habit, non-pressure habit, biting habits. Pressure habits where we apply force onto the tooth and the supporting structure. Because of that, the pressure will be created, and once the pressure has been created, the defects into the occlusion system has been seen. Now coming to the non-pressure habit where the pressure to the teeth are not being given. Now see the another classification which is set by the Fenn, which is like compulsive habit and the non-compulsive habit. Compulsive habits are the deep-rooted habits which have acquired a fixation into the child. The child tend to suffer the increased anxiety when attempt made to the correct. Non-compulsive habit, these are the habits that easily learnt or dropped as a child matured. Coming to the Klein, empty or unintentional habit. Empty and unintentional habits are meaningful or intentional habits. Empty habits are not associated when which doesn't have any deep-rooted plan. Meaningful habits, they have the psychological system. Now coming to the trends of the factors. There is a triangle which has to be seen regularly when you record for the habits. The triangle includes the duration, frequency and the intensity. Duration is the amount of the time spent onto the habit. When that amount of the time is regularly spent, then only it has to be seen as the duration. Now coming to the frequency. The frequency is number of the time per day a habit is practiced. If the number of the day per day the habit is practiced, then only the frequency has to be taken care. Intensity is nothing but the amount of force applied onto the teeth. Now various habits. Coming to the various habits. Among the various habits, we have thumb sucking habit, tongue touching habit, mouth breathing habit, which includes the bruxism, nail biting and the lip biting. Coming to the thumb sucking habit. Let us see about the thumb sucking habit in detail. Coming to the thumb sucking that is being observed in children below the 3 years of age when the thumb or the finger digit sucking has been observed. We can see about the oral phase of the development. Oral phase of the development says when the child is still into the womb, we have this kind of a sucking pattern has been seen intrauterine life. The thumb sucking in fact is the common and is meant to be both psychological and nutritional needs. Most of the children discontinue the habit after 3 to 4 years of the age. If the habit is continued beyond the period or the different chance that it may lead to the dentofacial changes. Coming to the definition of the habit says, according to the Gellin, it's a placement of the thumb to the different level, more than one finger, or at the varying depth of the mouth. In this theory, the movement of the infant's head and the tongue towards an object that is touching its cheek, and this is a primitive reflex. This is maximal during the 3rd month of the life. Coming to the causative factors. Causative factors for this theory usually has been seen as a socioeconomic status, where in the patient with a high socioeconomic status, better fed baby, where it is a low socioeconomic status group which is unable to provide the infant with a sufficient breast milk, there is a more tendency for this habit to be developed. Coming to the second causative factors, which includes the working mother. Working mother which has been bought into the caretaker, which may have a feeling of insecurity and use of a thumb to obtain the secure feeding patterns. And here one more cause, this is called as a number of siblings. If the number of the sibling increases, the attention required by the parents to the child gets deviated. So when it is deviated, usually the child will try to have, as insecurity will be taken care by sucking the thumb or the digit into the oral cavity. Now coming to the order of the birth of the child. Later the sibling ranks in the family, greater is the chance of having a oral habit. Now coming to the diagnosis of a thumb sucking. Diagnosis of the thumb sucking is based previously onto the history, but we should never forget about the triangle: intensity, frequency and the duration. So here determine the psychological component which is being involved. What is the psychological component? What we have already discussed. Now coming to the question regarding the frequency, intensity and duration of this habit. Inquire about the feeding pattern, parental care of the child. The presence of the oral habit should be evaluated. Now let us see about the extraoral examination. In the extraoral examination, we have different types of the digits. So digits are when you examine the digit of a child which is having this thumb sucking problem, they will appear reddened, exceptionally clean, chapped, short nail finger and the fibrous roughened callus which may be present on superior aspect of the finger. Coming to the lips, where the upper lip may be short or hypertonic and the lower lip is hyperactive. The facial form analysis check the mandibular retrusion, maxillary protrusion and high mandible angle. When we see about the intraoral examination, we have intraoral examination which includes labial flaring of the maxillary anterior teeth because of the pressure of the digit or the object which is being constantly giving a pressure. Lingual collapse of mandibular anterior teeth, increased overjet, hypotonic upper lip and hyperactive lower lip. Tongue will be placed inferiorly leading to the posterior crossbite due to the maxillary arch contraction. High vault palate. Coming to the extraoral one, we have fungal infection on thumb. Thumbnail usually will be appearance is deferred as compared to the normal. Coming to the management of this, we have the psychological therapy. Among the psychological therapy, if the psychological dependence is suspected, the child is referred to the counseling. Now, the counseling includes the first behavior management, where we will be seeing whether the child is actively involved into these psychological problems or child tend to react its own attention seeking issues. So thumb sucking in the children with the age of 4 to 8 years need only the reassurance, positive reinforcement and the friendly reminders which will not keep the child under the pressure, where child will not have any kind of a difficulty in maintaining those appliances into the oral cavities. Now coming to the reminder therapy. What do you mean by reminder therapy? Reminder therapies are the one, as the name says, they remind a child not to go for the thumb sucking habit, which are like extraoral approach and the different kinds of the approaches which is given onto the appliances which are provided onto the I can say digits or the things where we will apply those reminders. So extraoral approach employed better favored preparations such as tasteless agent that is applied onto the finger or the thumb, where the quinine, asafoetida and other kind of a pepper we usually will apply onto the digits. And this is like totally in the care or the occurrence, this thing has to be being taken care for the children, and the parent has to be informed better, and there should be a counseling for the child to accept these kind of a approaches. There should not be a pressure to the child to have these kind of a approaches. It is like commercially available product like Fematide can also be used. It should be applied onto the finger or the nails and allowed to dry for 10 minutes so that it should not leave early. And a small coat can be applied in the morning and the evening till the habit is broken. And usually with this application, habit will be broken slowly. Coming to the ace bandage approach, like a longer shirts or the longer nighties with elastic bands which are wrapped at the end and extended into the bandage, where the digit will be or the hand will be totally tied inside, but it should be very very loosely fitting, I can say a garment which is given to the child, making them understand that your hand is being tied in something which will not allow a finger or a digit to keep into the oral cavity, and which is kind of a like reminder for a child not to use it. Now coming to the tongue thrusting habit. Tongue thrusting habit is a definition which includes a psychological, habitual or the function. Other than that, the etiology of the tongue thrusting habit is retained infantile swallow, upper respiratory tract infection, neurological differences, feeding patterns. Now coming to the heredity is also another cause. Now let us see about the extraoral and intraoral changes. Extraoral is lip posture, intraoral is a tongue posture. There will be a changes into the, I can say, the oral structure. Now when we see about this history, the patient should be upright, the lip touch usually has been done tightly, mandible raised through the teeth are brought together, facial muscles do not swallow any marked contraction, then that is a diagnosis of tongue thrusting. What is that? During the abnormal swallowing, usually teeth are apart, lip do not touch each other, facial muscles usually show marked contractions. These are the changes which usually been seen. Coming to the management, the patient is instructed to put the tip of the tongue at the correct position and swallow. And when patient learn the normal tongue position, it has to be reinforced and made into the conscious act also, where the nance palatal appliance which can be given for a child to wear it. What is a nance palatal appliance? Nance palatal appliance is nothing but a reminder for a child to swallow at the normal pattern. Coming to the mouth breathing habit. Mouth breathing habit is defined as a habitual respiration to the mouth instead of nose. The etiology for its abnormal development of the nasal cavity, partial obstruction with the deviated nasal sinus and infection or the inflammation. Now coming to the classification, it is like anatomic, habitual or the obstructive. Among the anatomical, habitual or the obstructive one should be taken care by the ENT people, and the clinical feature for that is the long narrow face, short upper lip, nose tipped superiorly, expressionless face and the dental effects. These are the one. And the high palate vault is high. Now coming to the diagnosis, the history, the patient can be questioned whether the child adopts a frequent lip apart posture. Examination has to be done with a nasal breather, and there are different types of the test which includes a mirror test, water test and the cotton test. So what is a mirror test? The double-sided mirror test is being used into the children, and we allow that mirror to hold in front of the nasal cavity and ask the child to take a breath and close the mouth, and it has to be counseled well so that the child can give the proper history. And if the fogging is been seen, whether both the fogging is seen, it means that child is taking breath from the nasal cavity. If one side of fogging is seen, it means the child is taking breath from one nasal cavity. Water holding test is our child is allowed, counseled, and ask the child to hold the water into the oral cavity for some time. And if the child is tend to retain the water for the longer duration, it means child is able to take a breath from the nasal cavity. But if the child is like mouth breather, he cannot take a breath. Coming to the cotton test, the small butterfly of the cotton has been placed in front of the nostril. Ask the child to close the mouth and the child will be taken a breath, and if the butterfly, the ends which are being placed like a butterfly, if fritters, it means the child is taken breath from the oral nasal cavity, and if both the butterfly ends are not frittering, it means child is not taking breath from the nasal, especially the child is taking care or the breath from the oral cavity. Now coming to the etiology and this and that cursor treatment for this. The treatment includes the occlusal therapy, which includes the splint. So now let us the splints, which are like vocalite splints, which is recommended to cover the occlusal surface and the nout gout. So duty of a pediatric dentist is to assess that these habits can be taken care early. At the early stages, this can be restored as early as possible. The treatment can be better. Thank you.